Mr. Chairman, thank you for giving me this opportunity to speak to the august audience about a program in India which has universal coverage, the theme of this session. I'll talk about the National Rural Health Mission in India, which reaches the entire country and all the public health facilities. Family planning is a priority, and in the current 5-year plan, country's development plan, we have decided that the family planning shall be a central part of all our efforts to ensure universal access to health in the 12th 5-year plan, which ends in 2017. With our population of 17.5% of the total global population and the land mass of only 2.7%, the pressure on India is quite substantial. Our achievements in the past decade has been quite good. In the census 2011 showed that the steepest decline in the decadal growth rate between 2001 and 2011 has been from 21.5% to 17.6%. The growth of populous provinces with high TFR have also fallen sharply after decades of stagnation. This is a positive feature that we have achieved. The total fertility rate has also steadily declined. Currently for our country it is 2.5 compared to 3.2 in the year 2000. The provinces contributing to 50% of the population, which are 21 provinces, have achieved replacement level fertility, that is 2.1. The rate of decline of TFR has also accelerated. These are the positive features of last decade. When we look at current use of family planning methods, more than 50% of our eligible couples are not using any modern methods and continue to have high unmet need. When we look at the couple protection rate of China and we compare ourselves, we have a long way to go to achieve those kind of CPRs. Our key objective is to provide information, services, and communities with regard to spacing methods to every client in every nook and corner of our large and diverse country, while at the same time we will not dilute our efforts in services for terminal methods. Every year about 5 million terminal methods are adopted in our country. The paradigm shift in policy, which Honorable Minister of Health, while chairing the inaugural session, had referred, is it leverages huge workforce under the National Rural Health Mission. The National Rural Health Mission, which started in 2005, it operates all across the country. The mainstay of the implementation of NRHM are basically two community level workers, ASHAs, which stand for Accredited Social Health Activists. They are about 0.86 million, and also we have auxiliary nurse and midwives, they are 0.2 million. This more than 1 million grassroots level functionaries are the drivers of our National Rural Health Mission, in which family planning is a core issue. The unique effort which was conceived by our Minister, Sri Azad, who chaired the session in the inaugural session today, about 3 years back, was to ask these ASAs are women health activists, to deliver contraceptives, particularly condoms and oral contraceptive pills, at the doorstep of couples. These 860,000 village community health workers deliver the contraceptive services, including the pregnancy testing kits to different couples. Involving ASAs as a catalyst for delaying age at first childbirth and spacing between the birth was a unique experiment that we did in our country. I spoke about the auxiliary nurse midwives. They are about 200,000 in number. They have been trained to provide ICPD services on fixed days at 150,000 rural health sub-centers in close vicinity of the community in a scale which is unprecedented. That kind of capacity building efforts that has gone into training these ANMs and ASAs over the last couple of years has been tremendous. We are all, as a part of our policy within the National Rural Health Mission, we are promoting postpartum family planning methods. Capitalizing on the opportunity provided by increased institutional deliveries, we have a program called Janani Suraksha Yojana, means protecting the mother. Around 11.34 million deliveries which take place in public health facilities where women are brought to the public health institutions for delivery. We try and promote postpartum family planning methods. The 276 district hospitals in high focus provinces and other high case load facilities have been identified for strengthening PPICD services. Deployment of dedicated family planning counselors. They are all RMNCH counselors at district hospitals and other high case load facilities is a major boost to achieve our objectives. Intensification of skill development within the National Rural Health Mission is a major achievement. Within that, training of ASAs in counseling skills and follow-up of clients is taken up. We provide training to auxiliary nurse, midwives, staff nurses and doctors in ICPD insertions, and more than 50,000 people have been trained in the last couple of years. The facilities becoming fully functional is also an issue before us. We try to provide full complement of services and with a focus on high case load facilities which are delivery points. The free bouquet of family planning services. There are free services to 200 million couples in reproductive age group in public health institutions across the country is given. These services include safe aversion and post-aversion services, postpartum services, adolescent reproductive and sexual health services, pregnancy testing kits. The family planning commodities are an issue before us. We have tried to have a mix of public and private sector in the production of family planning commodities. We are self-reliant and self-sufficient in manufacturing and supply of contraceptives. We export a large amount of different varieties of contraceptives to the rest of the world. We have achieved the economies of scale due to our own internal high demand. So because of the high volume of production of the FP commodities, our cost and quality both are very good. Our contraceptives are supplied free to clients under the family planning program within our country. Rejuvenating the family planning under the National Rural Health Mission is aimed at reducing unmet need, and it is the topmost of our goals. There are specific plans for family planning at not just the national level, but at sub-national and district levels. Our small health centers are equipped now to carry out with the trained staff nurses and auxiliary nurse midwives to carry out family planning services. This is why I wanted to present about universal access to family planning services and commodities within the National Rural Health Mission. Thank you.